Today we're talking about healthcare. If you're thinking about moving to Spain and you would like to know everything about this, you should watch this video. We will sit down with a doctor to answer all your questions. So in this episode, we are joined by Dr. Henk Landa. Thank you for being here.
Thanks for having me.
Of course. We're going to talk today about healthcare in Spain. It's a topic that a lot of people who are thinking about moving here or buying a property here have questions about, of course, especially if they're moving with their family, children, or when they're retired and need some more medical assistance. You know all about that. So can you start with introducing yourself a little bit?
Hello. I'm a family doctor, general practitioner. I'm half American, half Dutch. I've trained in Holland and I've been working here since 1989. I'm working in the private sector. That's something I will get into a little bit later. And it's a multinational culture here. We have patients from almost any country of the world you can imagine. So we have lots of Dutch patients, German, English, French, national patients, Spanish, Valencian patients. So the array is very big. And predominantly here we see not too much young people. We do see them in the summer, but it's more the pensioners that come here to live with the nice weather.
Yeah, exactly. You're saying, like, already mentioning that there's a difference here between the private sector where you're working in and public healthcare system. What are the main differences you would say between those two systems?
I would say that the public health system is very good. It is high quality. The scope is very large. It covers everything, transplants, dialysis. And in the private sector, you would get quick service, quicker. So there's no waiting list, so everything will go a lot quicker. But the array of services is reduced because we don't do transplants. There's hardly any dialysis. There is some. It is for like 80-90% of illnesses. The private sector is okay, but the public sector is actually the anchor of healthcare. Anything can be done there.
Okay, so you often would have it as well, where you treat the patient, for example, but when they need some special care that you don't do in the private sector, you would recommend them, or you would to the public sector, right?
That's right.
Yeah.
That's right.
Okay.
Also in emergencies, I would say the 112 service we have here is like when you call 112. All emergencies are there, a burglary or an accident or an ambulance. Yeah. That works very well, and that's all linked into the public health care. That works fantastic, but a lot of people don't have cover for the public system, and it can become really expensive. And then it's a very complicated. Each and every country has different, say, treaties with the Spanish government. Within the European Union, it's a bit easier. Then most people that have a pension income in the European Union are entitled to get public health care. And then their health care from their home country will be transferred if they become resident in Spain. So if they're resident in Spain and they start to live here all year round or longer than 6 months a year, they can get the public health care. Now, a lot of people will like to have an extra insurance aside because they don't like to wait a year for an operation. They don't like to wait 3 or 4 months to see a specialist. So when it is emergency care, the public sector works very well. When we get to chronic illness or more of a diagnostic process, things can get very slow. So a lot of people who can afford it get an extra insurance, extra private insurance in Spain. And then there's many private insurances. There's like 30 of them. So you have to be very careful to choose a good private insurance. And most private insurances accept you to the age of 65. If you're over 65, some will still accept you, but then you have limited care. Also, any pre-existing condition in your private insurance will not be accepted. In the public insurance, yes. Yeah. Any illness you have, they are obliged to take you on and give you full cover. So the ideal situation would be that you would have access to public care and also access to private. Then you can work it both ways. So most residents here, they try to get that package under the public and under the private care.
Okay, and imagine if I would have to go to the hospital for something. Are there big differences that you would see in a Spanish hospital compared to a hospital, for example, in the Netherlands or the United Kingdom? Like the way they treat you as a patient, or what's expected for you to do yourself, or the service you get?
I think basically the service will be the same. In the private sector, they might be a little bit more friendly. In the public sector, they will treat you more as a number, as a mass. But the service is good. The difference is once you're in a hospital in Spain, the nursing care and the care is more limited. It is good enough, medically speaking, but you might need family to help you with the washing, to help you with eating your meal if you're a bit weak. They will try to do it, but they just don't have the amount of staff as we have up north or in the UK, or that we have in France or in Germany. So they're often surprised, and if they're a couple and they're both getting on, sometimes can be a great problem. So what we see here, we have a phenomenon in this area that there's a number of charities that take care of that. And it could be religiously based, it could be a church charity, it could be just a group of, I would say, a social charity. So that does help in these extreme cases, but usually they count on family members to help.
Yeah, because I've heard that a lot as well. Yeah, where people would go to the hospital and actually they needed somebody there to take care of them instead of, you go to the hospital and the nurse takes care of you. And so that's it's a difference at least between what we're used to. But besides that, I have heard as well that Spain has one of the best healthcare systems in the world, I think.
It's true.
Could you explain a little bit where that could come from? I mean, you don't have to come with facts and details, but...
No. Look, like 10 years ago, that was true. We have a lot of political problems in Spain. So healthcare, you cannot say there's Spanish healthcare. There's 17 communities, comunidades, and those communities have the power to legislate their own healthcare. So you would get a completely different healthcare in the Basque Country as you would get in Andalusia. So if we talk about the Valencian community, the healthcare is very good. It's very good. It is a high level. The consultants you will see, the specialists, are very well trained. So we get a very good quality healthcare. The problem is that we just don't have enough doctors. But that's all over the world.
Exactly, yeah.
It's not just here. It's also in Holland, it's in Germany. And the problems are that, look, I'm getting on as well. I'm 61 now, so I'll be getting a few more years and then I will retire. But a lot of my age group are retiring now. So we get a very high amount of doctors retiring. The amount of young doctors coming in is not enough to cover that. That has not been planned well. So, and it takes about 10 years to train a doctor. So you're always a little bit behind. So
that's true,
the next few years we're looking at a shortage of doctors, but that, as I say, is all over Europe.
Yeah, so imagine I'm somebody who is thinking about moving to Havia or the Marina Alta area. And I'm moving, like I was saying before, with my children, or I'm retired and I know I'm going to need some healthcare. What would be the advice you would give to somebody in that situation when it comes to healthcare? They might be a bit, afraid of, where do I start, or what could I go to first?
Yeah, it depends on, look, what kind of a pre-existing illness you might have. If you have a severe pre-existing illness, like if you're in a process with chemotherapy, you're in a process with it, I would recommend try to stay in your home country until things have stabilized. Mm-hmm. Don't come over in the middle of a chemotherapy with an uncertain outcome. If it's more a maintenance therapy of a chronic condition, then you can easily come over. That will be taken care of. If you're planning ahead, get a Spanish language course ahead of time. That'll make your coming here a lot easier and a lot less stress. And it's really worth it. So if you can do that, please do that. And if you arrive here, get a Spanish language course. Most town halls here offer it almost for free.
Yeah.
So, and even Valencian language courses. So make use of it, and it's worth it. And you also meet people. You start to make a social network. I think that's another thing that's important when you come here. Try to build up a social network. Yeah. There are clubs, there are Dutch clubs, there are English clubs, there are European clubs, there are bowls clubs, there are all kinds of clubs around.
Exactly, yeah.
So you can get involved in that and then you get to know a lot of people.
Yeah, no, I think that's especially an important one, because a lot of people might feel like, especially in places like Javia, where it's a lot expat oriented, it's in the end you do need Spanish, especially if you want to make use of this public healthcare system. And when it's about your health, I mean, you need to know what you're talking about. So at least the basic level of Spanish is, it's kind of required. Desired, actually, it's desired. Yes, exactly. So the last thing I kind of wanted to touch on was insurances, so health insurances in Spain. So you were already saying that if somebody has any pre-existing conditions, it could be hard or maybe even impossible to get a health insurance, because you have to tell them before, basically, right? So imagine if somebody wants to make use of like, where should they start? Is there a difference between a lot of insurances, how they treat those things?
That will be a topic on its own. The best insurances stop cover for people entering into the insurance at the age of 65. So then you're looking national, very big companies. And they give you solid offer of healthcare. Then they have companies, we have smaller companies operating in this area that give good cover, and they can take you up to 75. So that's another option. Now, you always have to be very careful, because there's many packages out, and it's like buying a new car, you see all these little box ticks, and they try to confuse you. And so you really have to take your time, shop around. I would definitely look at different companies. And there's one phenomena in Spain that you should be very aware about. We have a corredor de seguros, and we have an agente afecto. So we have an agent, and we have like a super agent. The super agent is the corredor. To become a corredor, you need to study 4 years. And it's a big study, there's a lot of responsibility, but then you are allowed to sell any insurance package in Spain that's legally on the market. So they can offer you all different healthcare packages. Okay, now, most insurance companies here work with affect agents, an agente afecto. So an exclusive agent, if I would put it. So that agent is only allowed to sell from one single company, one type of package, healthcare, car, home, whatever. So they will always talk you into their product, because they cannot sell another product that might be better. Yeah. Okay? So that is something very good to know. So if you really want to get unbiased, more information, go to a corredor.
Exactly, and I think it also depends. Some insurances only work with certain hospitals, right, where you can pick out of. So all these things you probably have to take into consideration when you make a decision of which insurance to go for. Yeah.
And nowadays, to become resident, like for the British expats, now after Brexit, it's a lot more complicated. They are obliged to get a private healthcare package. So they have to be very careful, and usually the banks they're the first people that know you, and they sell you something very basic that later it works to get your residency, but hardly any of our private doctors work for those packages, because they pay very little, and they're very cheap, and the bank gets a commission. So you have to be very careful there.
Well, I think we got some very useful information today, so thank you so much for being here. If you're looking at this video and you have any other questions for Dr. Henk Landa, I will put his details down below in the description. And if you're new to this channel, don't forget to hit the subscribe button to stay up to date with our latest videos.